Hello dear students, myself Dr. Maddineni Srinivas. Welcome back to my YouTube channel. So in this video we are going to cover kissing lesions in dermatology taken from the residence page of IJDVL, and also at the end I am going to add on few other important terms which were not covered in this journal related to kissing term in the diseases. So if you are not yet subscribed to this channel, please do consider so that you are going to get awesome dermatology related videos on a regular basis. And also if you are not yet liked this video, please do hit that like button so that I will understand that students are interested to watch these videos on a regular basis related to dermatology. So let us begin the discussion with the differences between the kissing lesions and the flexural dermatosis. So by looking at these terms, it may appear that both these are one and the same, but there are some subtle differences. Like for example, kissing lesions, as you can see, the lesion size is going to be very small and they are going to be in mirror image locations. So they are small and discrete and mirror image locations, as you can see in this picture. So this is the patient of syphilis having this kissing lesion. Whereas in the flexural dermatosis, usually remember they are going to be the disorders which are having lesions predominantly in the flexural areas, like for example inverse psoriasis, intertrigo, atopic dermatitis and Hailey-Hailey disease. And also you can remember that larger body surface area is going to be affected in the skin folds. And also remember this kissing lesions and also flexural dermatosis, they are not mutually exclusive. So one condition may have the flexural area involvement predominantly, and also flexural dermatosis may also have the lesions precisely which can be opposing, so they can be also described as kissing lesions, right? So what is the history? The old examiners, they may ask, they may be interested in this history part. So when Michael Paul used this in the case of the divided or the kissing nevus, later on Fuchs has coined this congenital melanocytic nevus term. And why, what is the reason, what is the basis for this congenital melanocytic nevus to have this precise kissing lesion pattern? So there is a simple embryologic reason for that. So initially during the embryonic development period, the eyelids are going to be undivided and they are going to be attached with each other, the upper eyelid and the lower eyelid. Later on during the embryogenesis, what happens is at the 5th and 6th month, the adhesive bands between the upper and lower eyelids are going to be separated. And before this separation, what is going to happen is there is going to be this melanoblast are going to come here and they are going to be present, they are going to populate the upper and lower eyelids. Because this is happening before separation, what happens is exactly at the mirror image locations, they are going to see after the division, after the adhesion bands are separated, their lesions are going to be precisely present in a kissing pattern. So that is the reason why the congenital melanocytic nevus over the upper and lower eyelids is very famous for this term. Not only that, even you can remember the other side, that is a coronal sulcus, that the reason because of which the inner foreskin and the dorsal glans penis are going to have this kissing lesion. We are going to see what are those conditions of the glans penis showing this kissing lesion pattern. So briefly you can remember the classification of the kissing lesions can be divided into congenital conditions and those which are infections which are non-sexual transmitted and infections which are sexual transmitted, and also we have certain metabolic disorders, and finally we have certain neoplasias. So first let us cover the congenital, where you can remember kissing or divided congenital melanocytic nevus. As you can see in this picture, this is a patient of CMN present over the upper and lower eyelids, and this is also having other names. This is also called as split ocular nevus, or it's also called as panda nevus. And like I have told you, this is the ocular nevus, or this is the picture where you are able to see this congenital melanocytic nevus present over the genitalia, right? Next, you can remember these names: divided spotted grouped pigmented nevus, divided nevus spilus, divided epidermal nevus, divided mastocytoma, which is going to be present over the adjacent fingers, kissing cafe ole macules. Okay, so these are some of the congenital conditions. Coming to the infections which are non-sexually transmitted, and a very characteristic one is oral candidiasis, in which the median rhomboid glossitis, as you can see here, this is the rhomboid pattern which you can see here, diamond shape. So it is going to produce the kissing palatal candidiasis. So you should also examine the palate also in these patients, where you suspect the oral candidiasis, especially the median rhomboid type of candidiasis. Next, you have this impetigo intertrigo. Basically, these are going to have the opposing skin surface involvement. Then we are going to describe them as kissing lesions. And in the STIs, you can remember the kissing chancre. As you can see in this picture, chancre usually will present as a single lesion, but there is a possibility that there could be the opposing surfaces having the chancre, which is called as kissing chancre. Next, you have the kissing chancroid, which is because of Haemophilus ducrei. Haemophilus ducrei, you all know that there are going to be multiple genital ulcers, and usually they can be opposing skin surfaces having these ulcers. So this is described as kissing ulcers in the case of this chancroid. Kissing condylomata lata, which is basically a secondary syphilis, where we are going to have the broad-based moist lesions, especially over the opposing skin surfaces. In the genitalia, they are going to be seen usually most commonly. And also you can see genital warts and molluscum contagiosum in mirror image locations. Basically the concept behind this is because of the auto inoculation, which is described as pseudo covernization. Right. Next, you have this granuloma inguinal dermatosis, which is produced by this Klebsiella granulomatous, which can present with this kissing lesions. Next, we have this irritant conditions which can produce this kissing lesions, like for example is Pedrus dermatosis, Pedrus dermatitis, or which is also called as blister beetle dermatitis, or which is also called as dermatitis linearis. Basically here what happens is there is going to be this beetle which will be crushed between the surfaces. Like for example, a beetle has it is flying and it has laid over the hand over this side, and during the night time usually these beetles are going to be present roaming around, and when it gets crushed, what happens, this hemolymph which is present, which consists of pedrin, it's going to be coming out. It is basically a toxin irritant. It's going to produce the same lesion, the irritant contact dermatitis, at the mirror image location. So that is why this is very common in the Pedrus dermatitis. Next, we have this Zuhn's balanitis, which is basically plasma cell balanitis. Here, because of this smegma in urine, which may act as an irritant, it may produce this Zuhn's balanitis, which is producing a kissing lesion pattern. Next, you have this inflammatory and metabolic, like for example, Lipschutz ulcer. Okay, kissing hydradenitis suppurativa, where precisely the penile shaft and the opposing scrotum may be affected. Okay, and porokeratosis tychotropica, here you can remember perianal and gluteal regions are going to be classically affected, and here this has been also described as butterfly pattern. So remember, butterfly pattern may be seen in other skin disorders apart from the systemic lupus erythematosus, and also apart from malar area. As you can see here in the porokeratosis, the patient is having this butterfly pattern. Next is kissing xanthelasma. Here the involvement is going to be even in the absence of the abnormal serum lipid levels. So that is one important point which you can remember. And in the neoplasias, you can have this benign and also malignant neoplasias, like for example kissing basaloid follicular hamartoma, kissing melanoma, and also kissing sebaceous carcinoma. So in the kissing melanoma, the point to remember is the same pre-existing congenital kissing congenital melanocytic nevus, it may get transformed into the melanoma. So monitoring of these patients is very, very crucial. So this is the flow chart of this classification of the kissing lesions. I will put this as an image in the WhatsApp and also in the Telegram. The links for them are in the description. Okay, and also I will leave them in the first comment. So next, the disorders which are having this term kiss, or which are transmitted via the kissing, and those flexural dermatoses which are going to have this opposing skin surface involvement, we are going to discuss that. This was not there in the particular residence page journal. So American trypanosomiasis, which is also called as the Chagas disease, it is caused by Trypanosoma cruzi, where the vector is redovid bug, which is called as kissing bug. Okay, here so it is not romantic sign, it is a Romanas sign. So where it's going to be the patient having unilateral painless periorbital edema, which is associated with the acute infection. This is American trypanosomiasis. Next is the angel's kiss, salmon patch or nevus simplex. So as you can see here, the term kiss is there here, which is going to present as this telangiectasia erythema present over the glabella. Not only that, even we can see the forehead, upper eyelids, and also the nasolabial region involvement, right? So this is also called as stork bite if it occurs over the nape of the neck. Next is erythrasma because of Corynebacterium minutismum infection, especially in the axilla and also in the groin. Familial benign chronic pemphigus, which is also called as the Haley disease. The involvement is going to be the flexural area. We are going to discuss these in the different videos. Next is Foddy spots, ectopic sebaceous glands. So basically the kissing sites, like for example the lips and the mucosa, can have this Foddy spots. And also obviously the cold sores, that is a herpes labialis, orolabial herpes. Here HSV1 is the most common culprit, where it is going to be transmitted because of the kissing. Next is infectious mononucleosis. It is also called as a kissing disease or glandular fever. So it is due to the Epstein-Barr virus in immunocompromised individual, and also in the Lipschutz ulcers also this particular condition is associated. Next, inverse psoriasis, which is also called as intertriginous psoriasis. So here the involvement is going to be in the skin folds, and the classical point related to the inverse psoriasis is going to be the absence of the scaling. Scaling, which is very classical in the psoriasis, can be absent in this condition. Next, secondary syphilis, mucus patches can be seen. Okay, seborrheic dermatitis can be affecting the intertriginous areas, where we are going to see this yellow greasy scaling. Okay, tinea cruris and intertrigo. So here we can see tinea or candida involvement affecting the flexural areas. So I hope this video was helpful. If so, please do that like button, and if you are not yet subscribed to this channel, please do consider subscribing, and also share this among your friends. And in the comments you can ask any query which you have related to this topic or any other query related to dermatology. Thank you so much. Happy learning. Bye bye. We'll meet again very soon.